Good afternoon, and welcome to number 6 Commonplace for this government information briefing. Today, on the 11th of May, the total number of persons diagnosed as being actively infected with COVID-19 is 4. That is up just 1 over the past 3 days. You will also see that we've greatly increased testing because the number of tests carried out now is 4,155, which represents 13% of the population. The results pending are 345. To date, we've had a total of 147 cases since mid-February, and of those, 143 are now recovered. Today, once again, there are no COVID patients in our hospital wards or in ICU. Our Nightingale facility remains a virginal demonstration of this community's success in warding off at least the first wave of COVID-19. I must also tell you that swabbing programs in ERS identified one carer who was asymptomatic as one of the 4 now active cases. As a result, the whole floor where that person worked at ERS was swabbed. All swabs came back negative. A further test will be carried out at the end of the week on all residents again, just out of an abundance of caution. It is in that context that the government has today approved the final iteration of our Unlock the Rock strategy. We've already embarked on phase 1 of the strategy, as we announced almost 2 weeks ago now. Next week, we will start phase 2. I want to be clear with you, though. Our message will not change. We will continue to advise that the staying at home is the best way to stay safe. But we will change our posture. With a small number of cases and an increased ability to test and track exposure to the virus, we will be moving from a situation where we restrict movement by compulsion to a situation where we are more targeted in the restrictions that we impose. Because we want to lift as many restrictions on movement as possible as soon as we are able to do so safely. So in this first phase, 12 days in since we started to relax matters, we're not seeing yet any exponential growth in infections. And therefore, we're going to set out in our strategy document that we're on track to enter phase 2 in the week of the 18th of May. On the 21st of May, we will see a further loosening of the restrictions on personal movement, both for the over 70s and the under 70-year-olds. But we will not change our advice, even if we change our laws. Our advice will still be to stay at home. And that advice will be the same for everyone, but it will be particularly emphasized for our over 70s. It will be similarly overemphasized for those in our community who are immunosuppressed, and indeed for those who are obese and have a BMI of over 30. Those are the persons who, according to the emerging data, the virus is killing most aggressively. And all of that advice and change of posture will be captured in this document, our Unlock the Rock document. I want to thank ministers for their input into this work. Each department has provided careful and detailed input into the preparation of this route map. Ministers and their teams have worked very diligently indeed to make this as complete a document as possible, because we wanted to give as much detail as possible for people to start planning in future for their personal lives, their working lives, and of course, the operation of businesses that remain closed for now. I've also shared the document with the leader of the opposition as a draft. He has shared it with his shadow cabinet with my consent. Having seen the early embargo document, they have provided significant feedback for which we are grateful. Incorporating their views will assist in making a clearer document. But I want to be clear, of course, that at this stage, everything is very, very fluid, even now. So we may have to change the running order of things set out in the document, because preparing this document for the specific circumstances of Gibraltar has been devilishly complicated. And of course, dealing with the virus is not an exact science by any means. So we may have to stop progress in respect of the phases envisaged if the rate of infections picks up again, or we may be able to accelerate if there is a cure identified earlier than anticipated. What I do want to say is that we cannot lose track of where we were the day we announced our first restrictions. We were being warned about the potential of tens of thousands of infections in Gibraltar, and we were being advised about the need to prepare for hundreds of deaths in a period of weeks or months. That would have been unbearable for our community. That is what I reflect in my foreword to this document. I remind the community that it was for this reason that we locked down in what has been a light version of the lockdowns we've subsequently seen elsewhere. That is what is going to make unlocking harder, because we are already at the stage in which other nations will not be for some time. Turning now to the document itself, there is a detailed introduction by the Director of Public Health. Dr. Batty has been a leading voice, of course, during the course of this public health emergency. He will be joining me tomorrow as we publish the document at 4 p.m. We importantly then go through the state of the law and how it has developed, and then we detail the approach to unlocking. This details how we have reached R0 and how we will approach antibody testing going forward. Importantly, we then set out what the new rules of social distancing require, what the new rules of respiratory hygiene provide for, and what the lifelong rules of personal hygiene require, some of which you might have thought nobody needed reminding of. The document emphasizes how important these basic issues are going to be going forward. Then the next part of our document is about the phased unlocking. That goes through the phases in details. You're already aware of what Phase 1 provided for, as we are already in it. Phase 2 will start on the 18th of May. On that day, we will start to see a return of some museums, libraries, and exhibitions. Phase 2 will also provide for the lifting of laws against free movement. This will take effect from the 21st of this month if things are progressing well and we see no increases in infection rates. So from that date, we expect that we will move away from the law restricting free movement, but with two key caveats. Firstly, our advice will continue to be that it is safer to stay at home. We expect to be able to change our legal posture, but not our advice. And secondly, we will continue to have rules about large gatherings. So the law will still restrict the constitutional freedom of association. Importantly, we will start to see more activity in our health services also, with a return to screening, etc. And we also expect commercial gyms to be able to reopen in this phase, but subject to tight controls. We will see a return to parliamentary activity in Phase 2, with a meeting of Parliament on the 28th of May, of which I have given notice today. At this time, we will also see a return of construction works within dwellings, also subject to permits and strict rules of social distancing and the wearing of masks. Education will also start a phased return, as already highlighted by Minister Gilbert Likudi and as agreed with the Teachers' Union. Then Phase 3 will commence on the 1st of June. This is the phase in which we expect to see a return of religious worship, but subject to very strict distancing controls. This will also provide for the return of public transport. Additionally, this will be the beginning of the closure of Chatham Counterguard and the part closure of Linewell Road. At the same time, we will see the restart of public transport with new arrangements where relevant. Some theatrical, musical and dance performances will be permitted without a live audience for filming and broadcast purposes. Importantly, restaurants will be able to reopen with restrictions of up to 50% in terms of occupancy. Public health permits will be required for the opening of restaurants. Finally, in Phase 4, from the 16th of June, we will be looking to reopen bars and cafeterias subject to public health permits. We also expect to open the bathing season in mid-June. And I want to be clear that our ambition will be to see a normal bathing season with normal beach going. We do not want to see any restrictions whatsoever on our ability to attend beaches. But this will require common sense from the public. You will have to pitch your tents further away from each other than we are used to. So we will not be able to crowd around the shore and the best spots as we each like to do. But this will be essential. We have to reserve, of course, the right to impose restrictions if the infection rate of COVID-19 increases, but we are hoping, of course, that it will not. We do not want to see a restricted bathing season. What we will be working to do is to offer the over 70s who wish, that is to say, not by compulsion, those who wish, areas which will be reserved for them exclusively. We are considering making Europa Pool and the bathing pavilion at Gassa exclusively available to our elderly citizens so that they can bathe without mixing with younger members of the community. The next two phases, Phase 5 and Phase 6, are essentially review phases for restaurants, bars, cafeterias and gyms, those that will still have restrictions in place, and we'll see a further loosening of those restrictions over those phases. If necessary, we will review any beach-going restrictions that may have been in place. And thereafter, assuming everything has gone well, which is a big assumption, then we will move to rock unlocked, phase new normal as we head into the autumn. That will be on the 1st of August. That is also a moment where we will have to be most alert to how things may progress. It will be in that stage, in rock unlocked, that attendance at funerals and weddings may then be more normal, but there may still be a maximum number of people prescribed for attendance. Our document then goes on to provide advice on daily life and advice on work life and business life in some greater detail. Then there is also detail on access to Gibraltar by land, sea and air. We are reserving our position on quarantine, etc., as these matters work on a reciprocal basis, obviously. And we're already talking to the United Kingdom and to Spain on such relevant mobility issues. There will be temperature scanning, as well as the potential for field tests of sorts on departure and on arrival from Gibraltar Airport. But these things are still in development, and we're therefore identifying these issues, but not yet able to fix our views entirely. We then go into issues about how the public sector will deal with matters in the future. And in particular, we're keen to never go back to some practices which unions and governments take the view are not efficient and which we want to move on from. This will help us in digitization and in leaving behind old-style counters. Our detailed document then goes through some specific public sector matters. Education is dealt with in detail, as are health and justice. Additionally, we will deal with the work done on when sports can return and how each sport can return. You will then see how we deal with promoting self-diagnosis and encouraging this, as well as how we will deal with a massive testing program that we're going to roll out. All of this, of course, will require aggressive contact tracing, and that is also dealt with in detail in our document so that people understand what we are proposing in this respect and how we propose to address the issues that arise. The final cog in the wheel will, of course, be isolation. And that is what we address in our final substantive chapter. Finally, the document pulls together some mythbusters from the World Health Organization. And so you may ask yourself, why are we not publishing the document today? Well, for two reasons. The first is that we're making final adjustments after the decisions of the Cabinet today to lift the laws on restricting free movement from the 21st of May, whilst maintaining restrictions on the freedom of association and gatherings. I've discussed and agreed these matters with the Leader of the Opposition today also. So we have to make those changes to the document. They are in the general public's interest, and I've been very true to my oath to you, to guard against any unnecessary restriction on your civil liberties for a moment longer than is necessary, even though as a result we've had to change the document that we were envisaging. And the second reason that we're not publishing today is that the United Kingdom has delayed the publication of its own document until later today, and we need to keep an eye on that as we publish our own document. So, what is the headline of today for the government? For us, it is the hope to be able to move away from laws restricting your freedom of movement from late next week. The next headline is that we will be linking the rules for the over 70s to the rules for the under 70s, also as from the 21st of May. This will be detailed more clearly in the timeline which will be contained in our document. But another headline for us is that whilst we will move away from compulsion to advice, we will do so without changing our advice. Our advice will remain stay at home for now, whether you are over or under 70. And finally, everything I have referred to is based on us all observing the rules of social distancing. And also with this caveat. Everything is constantly changing, and our phases may have to change. But we're hoping to give you as much clarity as possible with our unlocking document. And so before I end this afternoon, it's worth noting that we've now offered over 50 information briefings or press conferences since we started lockdown. I want to thank the media for their work in providing questions during these sessions to scrutinize the work that we are doing. In particular, I want to thank GBC for offering this live feed on the national broadcaster every day. And I want to thank every single one of the journalists who have provided questions, either remotely or in person, for our sessions. We expect to change the nature of these events as we move into phase 2 next week. And so now, without more, I turn to their questions once again.
Good afternoon. Question from GBC. In light of everything that you've just been talking about the imminent lifting of restrictions on freedom of movement, but the need to maintain social distancing rules, how hopeful are you that the public will heed the government's advice when the Minister for Health himself was pictured in close proximity with senior GHA officials on VE Day in a photograph that's been widely circulated? It is a very difficult situation, I understand that, but do you think that sends a mixed advice to the public and could potentially hamper efforts to get Gibraltar back to normal?
No, because, look, I really think that we need to have an element of common sense about us and stop the nonsense of criticizing people that you might see in a moment are closer than 1.5 meters from each other. That sort of situation is so absolutely dystopian that it's not a society I would ever want to live in, and I certainly won't preside over any circumstances which bring about laws to that effect. Remember what it is that we're saying. We're saying that you must not be within 1.5 meters of somebody else inside for more than 15 minutes. Because if you are for more than 15 minutes within 1.5 meters, you are creating a risk of transmission of the virus. Assuming, of course, that you're not coughing over someone or sneezing over someone or deliberately breathing or spitting over someone. So it's nonsense to say, oh, we managed to catch a person within 1.5 meters for the instant in which, within 1.5 meters for the instance in which this photograph was taken. That is to completely misunderstand what it is that we are talking about. Look, and the people of Gibraltar have been the heroes of the past 8 weeks, especially our over 70-year-olds, because they've understood the substance of the advice, and they've kept to the substance of the advice and the requirements of the law. As we lift our laws, what we're expecting people to do is to continue to comply with common sense. So we mustn't come within a short distance of each other and touch each other and hug each other as we would in our natural Mediterranean style in the usual way. But if we happen to be within 1 meter of each other or 1 meter or less than 1 meter of each other for a moment, then look, the public health advice, in particular if we are outside, is not that there is a huge risk in that moment. So, look, everything needs to be put in context, and that some of the nonsense that I'm seeing on social media is just remarkable. I think it's a demonstration that we're coming out of the most difficult phase. People are allowing their stupidity to run riot once again.
From the Chronicle, could you detail the sort of contact that you've had with Spain in regards to returning normality to border flow, particularly now that Spain is easing out of lockdown?
So remember that Spain is easing out of a lockdown in a way that is, to an extent, what we have been doing since the moment we went into lockdown, because their lockdown was tighter in some respect than ours. In some respects, they're moving faster than us, so they're moving to open restaurants and bars with some social distancing, some enhanced social distancing and reduced occupancy sooner than we are moving. So we're in contact with them about when mobility will come back to their frontiers. Remember that there are statements that you've read about countries not reopening their borders until the end of October. But if you look at the small print of what it is that most nations in the European Union are saying, it's that they're not opening their external borders to third countries until the 31st of October. But they are looking at reopening Schengen borders and free movement across European frontiers, even beyond Schengen. So we're in contact about the possibility of Gibraltar having the same benefits as others have had in that respect, and I expect to be able to say more when there is something agreed. At the moment, we're each talking to each other, obviously with the concern that Gibraltar will have that there is more virus north of the frontier than there is south of the frontier. We need to protect ourselves from that as well. So complete mobility would create those difficulties. There is going to be, I think in most larger European nations, it's not something that makes a lot of sense for us, but a lot of national tourism, a lot of staycations. I mean, here your staycation will probably be in your own home, although there are plenty of beaches and lovely places to go in Gibraltar, but you probably wouldn't rent somewhere else in Gibraltar to go to. Some people in Spain will be moving around Spain. There is therefore the possibility of an element of tourism into Gibraltar this summer, but it's something that we have to be guarded with also. So we, of course, want to see arrivals into Gibraltar. That's good for business, but we want to see arrivals into Gibraltar in a safe way. And these matters are reciprocal. The Spanish will also want to see arrivals into Spain, which can be safe, and they will want to see Gibraltarians spending in the campo and beyond the campo, but they'll want to be assured that that is safe also, and we need to understand these things in a reciprocal way.
Chief Minister, Boris Johnson, the Prime Minister of the UK, yesterday said in his speech that he was allowing family members to be able to congregate at a 2-meter distance. At what phase of our lockdown will that be allowed, or at least recommended, to occur?
Well, I can tell you that I find it relatively easy to keep myself 2 meters away from you, but I would find it impossible to keep myself 2 meters away from members of my family. And so what we've wanted to do in Gibraltar is to approach things in a slightly different way. And this is what I'm telling you you'll find in our document tomorrow. Instead of going from restrictions in law, permitting in those restrictions that you should have access to your family and some friends, and then in a further stage lifting the restrictions in law, we're going to approach this in a slightly different way. Remember, the United Kingdom does not have a written constitution. Gibraltar does have a written constitution, and we're guardians of that constitution, in particular your safety and security, but also particularly your fundamental rights and freedoms, and one of them is the freedom of movement. We're going to lift the restriction on your ability to move. We're not going to lift our restriction on your ability to congregate. So the numbers of people gathering, I think the number will probably be 10. We'll restrict people's gatherings to about 10. But therefore, you'll be able to meet with your friends or with your family in the context of your freedom of movement having been de-restricted, but your right to gather being still slightly restricted. And in order to do so in a way that is safe, we're moving, of course, as you know, to try and have the technology available with this app that you'll carry with you, which will preserve your data privacy and the integrity of that, but will enable you and others to warn those who've been with you if you're diagnosed with having COVID. But we want to do it in a way that is safe. So we're going to say, if you gather with your family, please remember which members of your family you met with. So make a note if necessary, just to remind yourself, although it may sound strange that you make a note of which members of your family you see, there's a very good reason for it. I mean, members of your family are people you will love. And therefore, if you are diagnosed with COVID, you will want to be able to advise them quickly, if they've been in contact with you, that they should have a test too. And that's the process that we are proposing, and that's how we intend to do it. So we are front-loading this by moving quickly to undo the compulsion in law which restricts your free movement, and we're moving to a stage where we advise you as to how you should exercise that right of free movement in a way that is safe for you and safe for members of your family and your friends.
So do you have a certain phase at which these meetings will be able to...
As I've announced now, this will be part of what happens in Phase 2. Phase 2 commences on the 18th of May, and we anticipate that we will be lifting the restriction in respect to free movement on the 21st of May, which is the date for renewal of the under-70s regulations. but we will be tying the over 70s regulations to the under 70s regulations. You have one set of regulations which will no longer make a difference in respect of age groups, and which will then provide for a restriction on how people can gather and congregate, and that will apply across the ages. Thank you. Now a question, I think, from those not here this afternoon.
The first question is from YGTV. Does the government plan to ask the Spanish authorities to consider giving permission to Gibraltarians with second homes to visit those homes in the coming weeks for essential purposes?
So the answer to that question is no. We don't anticipate seeking that sort of restricted permission to cross the frontier. We're hoping to see the ability to cross the frontier to be open to all residents of Gibraltar, and indeed to all residents of the neighbouring province of Cádiz, to be able to access Gibraltar for whatever purpose is then lawful. So the issue is what freedom of movement is going to be permitted in Gibraltar, and what freedom of movement is going to be permitted in the neighbouring provinces of Spain, and having the ability for residents of those neighbouring provinces and for Gibraltarians to move for those legitimate purposes, whatever they may be. So the one that you've highlighted on behalf of YGTV is a perfectly legitimate one. People will have second homes. They haven't been able to visit them. They're not aware of whether their boilers have burst, whether they've had burglaries, etc. All of the sort of basic stuff that those with second homes will want to deal with. But you've got other situations as well. You've got people with relatives. You've got people who have matrimonial difficulties with separations, with children on one side of the frontier or on the other. Those, I think, largely have been dealt with. But what I find when you're in government, you need to be alive to, is that you are unable to list all of the circumstances which are deserving that you can imagine, because there are many more things thought of in our philosophies than you and I can sit down and write down. And therefore, we need to be open to the possibility for citizens to do that which they need, which we might not imagine they need to do. And so I prefer a more open approach with the Spanish authorities if we're able to reach an accommodation in that respect, which I'm confident we will be able to do.
Thank you. The next question is from the Panorama and was sent in from one of their readers. Why cannot families of residents visit Hillside even if we have to be tested before going in? My wife is really sad and misses her visits, and imagine how I feel living alone when seeing her in the occasional video link. It's very hard this lockdown to still be unable to visit her. There will be others in the same circumstances as well. I appreciate all that has been done in looking after our elderly, which has been excellent. But if we have our temperature checks, we would be the same as those staff coming in to carry out the necessary covers.
Thank you. Look, I fully understand how difficult the situation has been, in particular for those who have elderly relatives that live in institutional care. What we've done is been designed to ensure that we give those elderly individuals the best chance of getting through this very difficult period in our history. I think that Susan Vallejo and Antonio Marin and their crews are absolute heroes of this period of our history, because they managed to keep the virus out of Hillside. They've only Hillside and Mount Alvernia and the Macwing, etc. The only reason they've managed to do that is because they've been so strict in their controls, and because every single member of staff has themselves been heroic in their approach. If they've had symptoms, they've declared them. They've been very careful with their cross-infection protocols and their PPE. And when it comes to allowing relatives in, look, I understand the yearning to see a relative. I've had a relative in institutional care, and I understand how important it is to go to see them. But these rules are designed to protect the lives of those relatives. So I understand that our emotions are frayed and our emotions are hurt by the separation. Our emotions would be hurt even more by permanent separation, which is what death brings. And if we allow the virus into ERS, what we will bring is almost certain death to those who are our beloved relatives at ERS, and we therefore have to be a little more careful. It would not just be a question of taking temperatures, it would be a question of taking temperatures and full PPE being offered to relatives. We've got upwards of 300 people in some of these institutions, taking the temperature of 300 relatives, PPE for 300 relatives. All of that would be extraordinarily difficult, and it's just not manageable. So we will hopefully move to a different phase when it will become manageable, and I ask all those going through this please to bear with us, because we are not imposing these controls and these restrictions for any reason that is a desire of the government. The government wasn't elected to separate elderly relatives. It was elected to try and do its best for every single one of the people of Gibraltar, in particular those of the evacuation and referendum generation that are represented in our elderly citizens today, and we won't make them go through this difficult period for one moment longer than we are advised is necessary. But we will be guided by the advice. We will not be guided by our emotions, because that would be to allow our hearts to rule our heads, and in this very difficult moment we must allow our heads to rule our hearts.
Thank you. Regarding the UK's announcement yesterday, it's been in the press for a number of days anyway, about the quarantine measures from arrivals outside the UK. You tweeted last night that you'd spoken to Wendy Morton at the FCO and that you were hopeful that Gibraltar could be placed on the exempt list, the same as France. On what basis do you base that hope, and when do you think you might have some sort of a reply? And also, how would the exemption work with people in Spain using Gibraltar Airport, for example? And would we have to accept British nationals reciprocally travelling freely to Gibraltar for any of those established reasons that already exist?
So you've identified all of the questions. I'll call you when I have the answers.
You don't have any?
Well, I mean, let's be very clear. I don't think anyone in the United Kingdom government knows how they're going to implement that which they've said they might implement. There is a potential for the United Kingdom to be in breach of its continuing European Union obligations of free movement. Those have a caveat in respect of public health. But if the R factor is lower in the rest of the EU than it is in the UK, as is the case today, there would be no justification for the implementation of an apparently public health related rule, an epidemiologically related rule, when the areas that you're protecting yourself from have lower incidence of the virus and a lower reproduction rate than you do. So, I mean, we are watching the decisions of the British government. We're feeding in our own views in respect of Gibraltar. I mean, if you were being very empirical in your approach, you would say it would be Gibraltar that would have to protect itself from arrivals from the United Kingdom, not the United Kingdom that would have to protect itself from arrivals from Gibraltar. So I'm very confident that common sense will prevail. If it doesn't prevail, then look, as I've said before, these things work on the basis of reciprocity. So if there's a quarantine provision in respect of those flying from Gibraltar to the United Kingdom, there will be a quarantine provision in respect of those flying from the United Kingdom to Gibraltar. I imagine, of course, there'll be very few flying in either direction if that is the case. And I also imagine that that would be the position in relation to most other European and indeed international destinations from the United Kingdom. But I, of course, also think that if you're going to make an exception for France, where the R factor is higher than in Gibraltar, it would be very difficult to explain that discrimination in favor of French citizens, or indeed in favor of any citizen who is of any nationality that is already within France, in particular to British citizens of an overseas territory who are told of the same British family as those in the United Kingdom. But it'd be difficult to explain it to Spaniards, to Portuguese, to Germans, and to the Dutch and anybody else. So I think that this is a work in progress. There's a good reason for the United Kingdom wanting to consider these things, as we might too. But I don't think it's an issue that is yet mature. And when it comes to maturity, I have no doubt that Gibraltar will have made its case in a way that will have been understood in London.
Can I just have a quick comeback on that? I don't recall you mentioning hotels in the route map that you've just been discussing, because obviously that would be important in terms of how all that plays out. Any ideas when hotels will open?
Well, there's a reason I haven't mentioned them. It's that we haven't closed them. So the government has not closed hotels. So the government doesn't have to allow hotels to reopen. Some hotels are open, others are not. That's been a business decision made by different hotels. We've understood them having to close in some instances, and therefore they are in the included sectors for the purposes of being able to claim beat COVID measures. But we haven't closed the hotels, and 2 or 3 of the hotels are continuing in operation. Or 4 of the hotels are continuing in operation, and 1 or 2 are not. So we need to see how we help them to trade through this period. We'll be talking to them. In the old days, there was a hotel assistance scheme that I recall in the days when I was first elected into the House of Assembly in 2003. It may be that there needs to be a hotel assistance scheme as part of what CELAC brings to the equation for assistance of businesses. But this is not an area that we have to permit to reopen because it's not an area that we have forcibly closed down. Christina?
From the Chronicle, can I ask what the public health advice is currently on the possibility of a second wave?
So the public health advice on the second wave is that we have to be very, very careful to prevent one. And I don't think that you're going to get anything more precise from anyone at this stage. For example, today, I've seen that in Wuhan, there have been, I think, 5 new reported cases of community transmission, bringing the total number of cases in China to 19 at the moment. That's the data that's being reported today. So in that context, the question is, how did this start? Well, it started with one individual. Whilst there is one individual with COVID, if they're not properly confined, if we're not doing self-isolation properly, we can find ourselves with a return of the virus. So there is the warning about how careful we need to be. And this is about vigilance, making sure that if we see the numbers of cases go up beyond 10, beyond 20, what are we doing? Are we satisfied that we're doing enough to keep those new clusters entirely suppressed? You could continue entirely as normal if those clusters are entirely suppressed. You know where they are. They're in self-isolation. They're behaving themselves and they're not breaching the terms of the requirement for self-isolation. You can be comfortable, therefore, that the virus is potentially suppressed. If you have concerns that the numbers may be bigger than that you haven't got control of what the cluster is, you could be in the face of a second wave about to hit you. So those are the key issues, and I think what I've learned about epidemiology in the past 60 days is that it's not an exact science, but it's a science that is based around predicting and ensuring that predictions do not come true. I mean, the best epidemiologist is one who has accurately predicted and is never able to prove that he was right because he heads it off at the pass and nips it in the bud. And that's what I hope the success of what we've done in Gibraltar in the past 90 days since January and the work that was done then, and in the past 60 days of more aggressive attitude in terms of lockdown will have delivered for us.
Chief Minister, I just want to clarify in respect of restaurants and bars. I mean, will the restaurants be permitted to operate, obviously within social distance guidelines, in phase 3, and therefore bars in phase 4?
That's what I'm saying today, that in phase 3, we have a phased reopening of restaurants where there is a permit system in place so that we understand what each restaurant is trying to do in terms of distancing, in terms of occupancy, how tables are laid out, etc. And we may review that in phase 5 and see whether we are satisfied that there's been no spread of the virus from that particular factor. And bars coming in phase 4, also with constraints, and reviewed in phase 6 to see whether those constraints can somehow be eased.
You talk about phase 5 and 6. Are those mentioned within the Unlock the Rock?
They are. They are principally review stages. So you've taken most of the steps that you need to take by the end of phase 4, but a lot of what you're doing by the end of phase 4 is severely restricted. So you come back to some of those areas of activity in phase 5 and phase 6 to try and see whether you can further loosen the restrictions that you've still remained in place until you get to Rock Unlocked on the 1st of August, where you're trying to ensure that you have reached as close to a new normal as possible. I don't know whether there's any other questions from those who are not here this afternoon.
Thank you, Chief Minister. We have another question from the Panorama, which was also sent in on behalf of a reader. Will the 14-day quarantine planned in the UK affect air travel to Gibraltar? Are we going to be one of the exempt countries like Ireland, and what is the government doing about it?
Thank you. So the answer that I gave GBC refers. The fact is that if you look at what the United Kingdom has initially said, and I'm referring not to what the Prime Minister said yesterday in his ministerial statement addressed to the nation, and I don't know what it is that he's about to say in Parliament where he's making a statement. I'm referring instead to the briefings that we've seen, which were anonymous and which were carried in newspapers as from 2 Sundays ago. What was originally briefed was that the countries that would be considered exempt were essentially just the countries that are considered exempt from immigration controls today. So the south of Ireland, Northern Ireland, and the Channel Islands all fly in and out of the United Kingdom as domestic flights today. So whether you're going to Dublin or you're going to Belfast, although Dublin is in one nation and Belfast is in the United Kingdom, you fly into UK airports as if you were a domestic arrival. The same is true of arrivals from the Channel Islands. So there's nothing new in those areas being treated as different to arrivals from Schengen, the rest of the European Union, Gibraltar, or indeed third country arrivals. What was said yesterday by the Prime Minister was different to what had been briefed already for the previous 8 days. It was that there would be exemptions based on the United Kingdom's obligations internationally. One of the United Kingdom's existing international obligations are the obligations set out in the withdrawal agreement that continue the obligations provided for in the treaty establishing the European Union and provide for there to be no frontiers between European partners. And additionally, the Prime Minister said that there would be arrangements in relation to France and that restrictions would apply to arrivals by air. So I think there's a lot to keep in mind there and a lot to keep under consideration under the microscope, and the government of Gibraltar is making representations to the United Kingdom government as I've set out already.
Thank you. The final question sent in today is from YGTV. How far away is the government from choosing the right contact tracing app?
So I don't think the government is far away at all from choosing the right contact tracing app, because the government is going to pursue its own contact tracing app, which will have input from those who are preparing different contact tracing apps. But I think we're clear that we want to opt for the iOS Android model, the model that is decentralized, because we think that is the one that provides the best data protection, and we provide the best way, therefore, for people to be aware if they've been in contact with someone who has had the virus, but we don't control that data, and we therefore don't take liabilities in respect of that data. And indeed, we're seeing some reports from the United Kingdom that the United Kingdom app developers are a little concerned about inability to make the app for the NHSX work in the way that they anticipated. So that is likely to be our choice. I hope we'll be able to roll out by the end of May, which would mean that by the beginning of phase 3, we would have our own app already ready to download. Thank you very much indeed. Thank you for joining us for our 54th Information Conference from number 6 Convent Place. I do hope that as we have set out today, we'll be able to see the phases taking effect without having to go into reverse gear, that we will not see a return of the virus. If we do, obviously, we may have to once again apply certain aspects of the lockdown regulations. But my hope is that we're now moving forward. We're moving towards the lifting of restrictions. We're moving towards restrictions applying across all the age groups in the same way, with different advice, of course. But we're not changing our advice. Our advice remains that the safest place to be is at home, that you should stay home unless you have to go out. And although the weather may be nice, the virus is still very likely all around us, and we need to protect ourselves and our community from it. Thank you very much for joining us once again, and good afternoon.